Hi everyone, thanks for watching SF Live. I'm your host Carmen Chung. Today we have two guests in our studio from Self-Help for the Elderly. We have Karla Gardner, she's the program manager of the HICAP program, and also we have Linda Lasell, research specialist of HICAP. Thank you for coming.
Thank you.
Welcome. Thank you. So first of all, tell me about HICAP. What is HICAP? What does it stand for?
HICAP is initials for Health Insurance Counseling and Advocacy program, and it is a free program for seniors and the disabled who are Medicare beneficiaries or pending Medicare, receipt of Medicare. And so our program is a free counseling service to help them make decisions on supplemental plans and getting onto their drug benefits and so forth.
Also, HICAP is, in our city, available only to people that live in San Francisco.
Right.
However, there is a HICAP program in every county in California, and each serves the residents of its own county.
Right. So I don't want to get confused. So basically, is it a program under Self-Help for the Elderly, or is it a separate program, or how does it work? Because I think some people actually think, oh, it may be a service provided by Self-Help for the Elderly.
Self-Help for the Elderly is the contract nonprofit agency that received the contract from the Area Agency on Aging. There's quite a tier of different levels of government. Our funding begins at the federal grant level and then is passed to all the states in the United States, goes to the California Department of Aging, and then they disperse funds to the Area Agency on Aging throughout the state. And then Area Agency on Aging has contracted with Self-Help, and so here we are, HICAP.
I see. And basically, who do you serve?
We serve seniors, as Karla said. We serve people who have Medicare already or are about to get Medicare, whether by virtue of their age or because of disability. And again, we serve people in San Francisco.
Only for residents in San Francisco, am I correct?
Our program, yes. But there is a HICAP program in every county.
In every county. And is it only for seniors?
No, disabled as well, who are eligible for Medicare.
Right. Okay, very good. And can you also tell me the services that HICAP provides? I realize that there are a lot of services, right?
Our main service is one-on-one counseling that we do for the seniors and the disabled to help them choose their plan that will supplement their Medicare. To help them understand their Medicare. There are different parts to Medicare, and it can be very confusing to a lot of people. And there are a lot of plans out there to choose, hundreds of them, and so that in itself is very confusing. So first they have to understand their Medicare when they're new to it, and then how do they supplement, because it doesn't cover 100%.
Right. Now that you just mentioned about Medicare, tell me about what Medicare is, or what's the definition, or what does it mean?
Well, Medicare is a program that is through the federal government, available to those people who have worked and paid into the Social Security system. And it's also available to those who have not under certain conditions. There are so many rules around it in terms of qualifiers. But the basic sum of it is to understand that it is part of the Social Security system. It's the medical portion of the Social Security system.
Right. And basically, who are qualified or who are eligible?
For Medicare. Well, as Karla said, people that have worked and paid into the Social Security system. As an employee, part of what is taken out of your tax or your paycheck goes toward paying toward Medicare Part A. And if you have worked enough quarters, then you would be eligible for Medicare Part A when you turn 65, or as a disabled person at a different age, but generally at age 65. The second part of Medicare is Medicare Part B, which generally covers more outpatient services like doctor visits, x-ray, lab, some other things. Medicare Part B is considered optional. The reason being that there is a monthly premium for Medicare Part B, so no one is forced into taking that. But people generally do, because other insurances like supplement plans or Medicare Advantage plans require that an individual have A and B.
Right.
So A and B are referred to often as basic Medicare, Part A and Part B.
And what's the way, or what are the steps to apply, or is there any procedures or steps once I find out, if I'm qualified, to apply for the Medicare programs, where do I go, or what should I do?
Well, for most individuals who are working and paying into the Social Security system, the government already has your Social Security number, and that's how you're identified for the Medicare program. And they send you, prior to your 65th birthday, a welcome to Medicare, so to speak, packet that they give you your booklet and all that, and your card, your official red, white, and blue card. And that's how most seniors know it. And that is their introduction, and they give you an option at that time to make choices about adding to your plan.
So basically, people who are 65 or over, they would, or once they hit 65, they would receive a package.
Prior to
from the state or from the government?
The federal government.
The federal government.
Social Security.
Social Security. Right.
And if they don't receive it, they need to call Social Security and make sure that something hasn't happened with their number, to make sure that they get the right information and they're not missed in the system.
Right. And you just mentioned about the red, white, blue card. Tell me about that. What is that about?
Well, the Medicare card has blue and red stripes on the top. It'll have their name, it'll say Medicare Part A, Part B, and it'll have the dates of onset when they initially are entitled to begin their Medicare program.
And what's the difference?
The difference in
receiving and having the colors, the red, white, and blue. Is there any difference?
No,
or
that's
there's no difference.
That's just
it's just how it is.
Colors, yes.
I
they're
see.
patriotic colors.
I thought there was a little trick. No. Okay, great. And also, there is the long-term care insurance, right? So what's the long-term care insurance?
Long-term care insurance is a very specific type of insurance designed for people who have a need for convalescent care or custodial care, which is not something that requires acute medical care. It is more if a person is unable to perform what are called activities of daily living. If they cannot perform a certain number of those, then if they have a long-term care insurance policy, then the coverage would kick in and start covering for things like in-home care, bathing, dressing, transferring from a chair to a bed to a chair, that type of thing that isn't really medical. It's more just getting through the day because you're unable to...
basically the daily activities that they would need to do.
And it's very important to recognize that distinction from medical insurance because Medicare doesn't cover anything like that.
The long-term care insurance.
They do not cover custodial care.
Custodial care, right.
Nor does any other medical insurance. Long-term care insurance is designed specifically for that. So it's not everybody buys long-term care insurance. It tends to be rather expensive. And of course, the older you are when you buy it, the more expensive it is. But it's a very important piece of the insurance puzzle. Right.
And how can people get more information about the services?
They can call us at HICAP. And we have a 1-800 number. We also have a local number here in San Francisco. A local office.
And I believe the number is actually